Hi guys, I'm Dr. Nathan Ho. You are watching the Coffee Break Interview Video Podcast. Today I'm able to invite Trish Jorgensen back for a third Coffee Break Interview Video Podcast. And our topic for today is case presentation. Trish, I'm so excited to have you back for another video podcast.
And I'm excited to be here again. I love this.
Awesome. Today, I'm going to ask you about case presentation. This is a topic that I see a lot of dentists often ask in many Facebook forums. And, you know, when patients come into a dental practice, most of them need different types of treatment. And some are easy to present and some are hard. So do you have different approaches to present different types of treatment plans, such as a simple one versus a smile makeover or a full mouth rehab?
Absolutely, Dr. Ho. And this is a common question that I get too. I've seen dentists overwhelm the patients so much, and the patient may need a lot on their first visit, and they're not our patients yet. They're still interviewing us. And then on the other hand, I've seen doctors not focus on their chief complaint, only if they have a chief complaint. I'm talking about the ones that called with a chief complaint, and then they overwhelm them with everything. So yes, depending on the situation, but let's talk about a complete comprehensive examination of a new patient or existing patient. And a patient needs very little. I call these financial arrangements impromptus. And that means same-day financial arrangement. And that means it's not necessarily same-day treatment. I'm talking about same-day financial arrangement. Before they leave that day, they've been talked to about the fee, their investment, all the financial arrangements are arranged, and their next appointment is made. And as far as chief complaints, when a person comes in with a problem, the wording we have to do as a dentist is, you know, I really feel it's effective when they have a tooth that's bothering them, so that we can get this patient and turn them into a comprehensive exam, not that day, is to say, before getting them out of pain, whatever it may be, temporarily, anesthetic or whatever it may be, is to say, I bet you never want to feel like this again, do you? And of course, what their answer is going to be is yes. And say, I can see there's some other things I'm concerned about. So we'll take care of this. And we're going to go over everything about what it takes to take care of this one tooth or one area. And then we'll get you back for a comprehensive exam. Is that okay with you? And the others are going to say yes. So that helps build that relationship with that patient and not lose that patient because we didn't focus on what they called about. And then there's those, of course, we do the financial arrangements and talk to them about that. Then we have those that are coming out of hygiene that have maybe decided to move forward with that crown that we've had there for quite a while. And that's, again, a same-day financial arrangement. And I'm not talking about doing it, but sometimes we do it that same day, and there's proper words for that, depending on your schedule. But that's again another subject. But yes, so then there's the ones that come in for a comprehensive exam as a new patient, and they don't have one chief complaint, they have many chief complaints, or they have a lot of things that need to be done. And when the doctor's done doing that exam, he needs to sit down, back down, eye to eye, knee to knee, gloves off, mask down, and have a conversation with that patient. And you know, Sally, I can see that you have a lot of things that you're concerned about. I can see why you're having some discomfort, or I could see what you're concerned about, because in the unique way we get to know about these patients, we kind of know that ahead of time before the doctor goes in there. And so let's do this. Let's have you come back. I like to study my notes along with my pictures or x-rays, whatever you took, and x-rays, and have you back in a few days, and we're going to go over everything before we do anything. Is that okay with you? And we call that a diagnostic review. That's what we call it. We don't call it a consultation because from my experience, that just in the patient's mind means dollar signs. And that's a no charge. And I would have the doctor say, and by the way, this is a no charge visit. And either it is okay or it isn't. And most of the time, one of the objections the patients will say is, oh, doc, can't you just tell me now? You know, I could, and you just, you know, you gently gesture, I could. However, I don't want to miss anything. So could we please have you back in a few days? I want to study everything so that you know everything before we do anything. And most of the time they say yes. And we want to get those type of patients back in very soon because they start to lose their, I get them in within 2 or 3 days.
Yeah.
And I don't want the doctor to say 2 or 3 days. I want the doctor to say a few days because I do not want to lock that receptionist or that financial scheduler coordinator locked into a time that the doctor said.
You know, that's so important because as a dentist, we have the urge to tell the patients everything they need when we do the exam, right?
We do.
But there are patients that need full mouth rehab, that need 5 or 8 crowns.
Mm-hmm.
But if we were to tell them a treatment plan that costs $5,000, $10,000, or $20,000, and sometimes even $40,000 on
Absolutely.
the first visit, most likely they won't accept it because they don't know you yet, right?
They're not your patient.
Exactly. They're not your patients. They don't know if your shot gonna hurt them. They don't know if they should trust you with their mouth. So it's important to get them back for the second diagnostic visit, right?
Yeah. Yes.
So
You could call it diagnostic or diagnostic review, whatever terminology you use. Of course, the 88 code is 9310, which is consultation. But the goal is to get them back and in a office or a different room than an operatory, sit down eye to eye and knee to knee. And I could go into how that goes if you'd like me to, or we could talk about more about the other subjects.
Okay, so let's continue with the subject. So
okay.
So for the simple treatment plan that you get to present on the same day, or when patients come back for that diagnostic appointment, what are some of the things to say or to do to get the patient to accept the treatment plan?
Well, in the diagnostic review, I recommend the financial coordinator be in the room with them because they don't say anything. They watch and listen. They watch body language. There's no missed communication. We used to do it the other way, and the doctor would come to me and say, "Oh, she's so excited to do this. Get going." They'd bring her into my office, and I'd sit down, and then we find out, yes, she wanted it, but she couldn't afford to do it, or could only afford to do something. And the doctor would come to me and say, "What happened with that patient?" I'd say, "Well, we could do this," which I think is a success, by the way. Rather, you don't have to do it all. And he would say, "What happened?" She wanted it all. Well, usually we know that patients do want it all, but the reality is we're a business and we have to be able to do what the patient can afford at the same time, not become the bank. So in other words, we've got to be in there to listen as a financial coordinator and listen to what they're talking about so that I can deal with some of the objections or things that I can see that doctor can't see. I knew exactly what he said. I heard the benefits he said, and I can build from that when I do the financial arrangements. On the impromptu ones or ones that come out of the hygiene chair, like I said, I want to know, what is the benefit for that patient? Why do they need this root planing? Why this? What is it? How's it going to improve Dr. Ho's life or Trish's life, or how's Sally's life? Why is it valuable to them? Why should they do this? Or what are the consequences? And then when I begin to talk about finances, I sit back and the first thing I say is to the patient, if it's a toothache, I say, "Aren't you glad you're here? Dr. Ho said you got here in time." I brag on the doctor. "Aren't you glad you're here?" And then the next words are, "So how do you feel, Sally, about the treatment the doctor's recommending for you?" And it opens up a dialogue of really what they're thinking. Because sometimes they'll just say whatever you want to hear to get out of there.
Yeah.
And I find this more common when the patient's overwhelmed and the patient has been told too much too fast. And you have to be able to understand more about these patients. And in a unique way, Dr. Ho, that we introduce these new patients, we build that relationship before any of this so that we know more about them and how to proceed and what their needs and wants are. So we've got to have some words, and then we've got to have some tools to help them fit into their budget or whatever it may be. Some patients don't need to worry about that. And we need to ask questions that are open-ended. So how do you feel about the treatment the doctor's recommending for you?
Mm.
And they'll say, well, I just don't know how I'm going to be able to afford it. And I'll say, so if I understand you correctly, Sally, this is the type of treatment you would like to have if we could fit it into your budget. Because she mentioned afford, not me. And she said, yes, this is what I want if I could figure out a way to fit it in my budget. And that's where my tools would come up, and I would go over the tools that I have to fit it into the budget that we offer.
Those are great tips. And a lot of, over the last 9 years of practice, I realized that the number one thing that helped our practice so much is the payment plans with no interest, because many people can buy a brand new car and make payment plans, but not a lot of people can pay cash for a new car.
No.
So, yeah.
It's the reality. Yes.
Yeah, that's right.
And another thing on that is that when you use third-party financing, and there's more than out there than they used to be. I mean, years ago we didn't have anything, and I know one of the obstacles that doctors don't want to do it is because of the cost. But let me tell you, when you can do more treatment in one setting because you fit it into their budget, and you can do half mouth, full arch, even one quad, that 10% or whatever it may be is not relevant. And patients like to be able to make paid on a monthly budget. But these tools, when they use third-party financing, it's another reason why patients generally won't cancel. If they have to use their own money, unexpected life things happen, experiences happen, car breaks down, refrigerator breaks down, whatever it may be. And if you're going to use your own money, what's the first thing that's going to go away? Dental appointment or whatever it may be. When it's third-party financing, I have found that they will still come because they don't think it is their money, and it's a monthly payment.
That's right. Not just the saving for emergency things, but some patient they told me honestly that I need to go on vacation.
Exactly.
Or I want
a cruise.
I want to buy a TV instead. You know what I mean?
Yes.
So let's talk about some of the objections and how to handle them real quick. So you already talk about when patients say, "Oh, I don't have the money," right? What about when patients say, I gotta talk to my wife, I gotta talk to my husband"? How do you handle that? Or it doesn't hurt. I don't. Can I wait?
There's many objections that you deal with, like you talked about. And again, if you can deal with an objection with a question, that's not a yes or no answer. You find out more information. You're trying to really get more information. But like you said, I want to talk to my spouse can be very, very real. And
yes.
There's many times that this is the type of investment that I would want to talk to my significant other before I went ahead. Now, if they're coming back for a diagnostic review, we always invite the spouse. If the spouse called to make that appointment, that spouse is definitely going to be invited, because we know who makes the decision. And 75% of buying decisions are made by women. Did you know that?
Yes.
By women, mothers, wives. So it's not always, but that is a significant number to not ignore. So when they want to talk to their spouse, the first question that I would ask, say, well, tell me, and I would say their name, how would George feel? How do you think George is going to respond to this? And they'll say things like, well, they have dentures and they hate them. Well, you got it, girl. I mean, and that's good. Or we really need to talk. We got to figure out, I might want to take some money out of this or this or this. Those are serious. Those things need to be done. But here's what we like to do. We need to make an appointment of a phone call. I actually make a phone call appointment on our schedule that I follow up with them. And I would say, let's do this. Why don't I give you a few days and I'll call you on Thursday. What time would be good? And I give them an appointment card so that I can follow up with them. Because more than likely, and it's not too far away, because more than likely they're going to hear other people's opinions or I also would invite the spouse to come back in. And sometimes when I've called, we've done that. They've come back in. But that's sometimes it's just to get out the door. Sometimes they're saying, I want to talk to my spouse because they are just not sold. And I don't mean sold like a car salesman. They don't see the value. And when I've had those, I've looked back at where we broke down. Sometimes the doctor has not created the value. From a impromptu, he set up to the assistant and he said, she needs a crown number 12 with a root canal buildup, and walks out. That's not creating value.
Yeah.
It's hardware. You're selling hardware. Although we do hardware, but that's not what we're about. Help improving people's lives.
Yes.
And how is this going to improve that person's life? So yes, that is a true objection. Another objection that I've had is that I'm too old for this. And I tell a story, which is a true story, about Howard, 92 years old, that he told us that he just wanted to be able to dance with the ladies at the senior citizen center, and he ended up doing $21,000 worth of treatment. He was the happiest in his last 3 years of life I've ever seen, and he could chew better. His health was better. So use some of your real experiences. You can also get the objection where I've had somebody say, well, and then you got to be careful with this one. How long will this take, doctor? And we've actually shot ourselves in the foot with this one, because if they say, well, this is an implant, it's going to take 6 months to heal, and then we'll uncover it. And say, well, never mind, I'll just wait because I'm going to be moving in 5 months. So you've got to ask the question when they say, is how long is it going to take? You need to say, is a time a concern of yours? Because we don't know if they mean how many appointments does it mean. Yeah. I'm moving, I'm going on vacation, I want to get it done before I go. We need to find out more information, so you answer a question with a question. And another objection, this is actually from a mentor of mine, is a patient said to him, will my teeth look like let's see, I forgot her name. Oh my gosh. Roberts. What is the movie star first name? Roberts? Roberts, yeah. Okay, my mind just went like.
Not Pardon? Robert Pick, right?
Not Robert Peck, but she's a movie star. She's been in lots of shows, and she has a beautiful red hair smile. And he said, "Do you want your teeth to look like?" Oh, it's Julia Roberts. Just kidding my head. Do you want your teeth to look like Julia Roberts? She said, "No, I hate her teeth." So we've got to be careful. I've had patients come in and had their friends got some work done, and they said, "Will my teeth look like my friends?" And well, do you want your teeth to look like your friends? Well, yes, I love them, or no, I don't. So we've got to be careful when they ask a question, what they really mean, and deal with objections with questions.
That's awesome. So it seems like some dentists, including myself, okay, or in many dental practices, we're good at getting the patient to go for the first treatment or a couple of procedures. And then but we don't have a system to get the patients back for the rest of the treatment plan. What kind of system would you recommend the practice owners to implement in their practice so we can get patients back for the rest of the treatment plan and not just the first 1 or 2 procedures?
Well, the first thing is that when you have a problem-focused patient come in, we address that, and we want to turn them into a comprehensive exam by talking about that you see some other things that you're concerned about, and that I'm sure you never want to hurt like this again. So on your next appointment, is it okay with you that we do a comprehensive exam? So many times we don't ask the patient. We need to ask patients, is that okay with you? And they'll tell you their objections if there are any, and then we can deal with those. The other one is, and then once we've done a comprehensive exam, we can present treatment. And the things that doctors don't do that I think is what you're talking about is that we don't tell the patient everything when it's time to. I'm talking about when it's time to. Yeah. We do it when it's not time to, because we got a hot body in that seat, and we want to get everything we can because we got a hot body and some chair time. However, to really get a relationship with that patient, there's a time and a place. And when you build that relationship with the interview, the way that I do my introducing the patient to the practice, sometimes a patient will tell me exactly what they want. And even though it may not be the ideal thing, but at least we have a place to start. Now, on the comprehensive treatment that we've done, exam, and the diagnostic review, we need to tell the patient everything. And prior to doing my financial arrangements, I will sit down with the doctor, say, doctor, okay, here's the ideal treatment. What if they can't do this? What's your next area of concern? And we will figure out where to go. So I know where to go as a financial coordinator because my goal is to do everything. However, it does not happen all the time. It's a real, our bread and butter of dentistry is quadrant dentistry. It just is. And sometimes it's only one tooth. So I need to know to go where to go and what is obviously infection. And from my experience and what he says, he's the dentist. I need to know where to go and what other options are there are, if there are any options. If the patient, and we've gone through all the options as far as financial arrangements that we have to offer, our goal is this, Dr. Ho. I'll say to the patient, Sally, I really have tried to help you, and I know you've thought of ideas, and you want to be their counselor. You become their counselor. I'm no longer the money lady. I'm the counselor. And however, you never know when one's circumstances will change. And so you want to give them hope and keep them in your hygiene. Keep them in their hygiene recare system, because we've had many patients that their circumstances have changed, and guess where they're at? They're in your practice. You want them to be in your practice, not the one down the road, because you didn't make them feel it was all or nothing. You had choices. So yes, I see what you're saying, but we have to present it all so that the patient's not surprised. Or you'll hear this, Dr. Ho. Every time I go in to see my hygienist, I need another crown. We have to present everything and let them know. And then they won't say things like that. Doesn't mean they're not going to do everything at that time. It's something that's there, and we're going to do it when they can financially. But at least you won't hear those words. I've heard patients come from other offices. Every time I go in there, I need something. That's because the doctor has not told them everything.
That's awesome. Those are some great advice, Trish. Thank you so much.
You're welcome.
So if someone have more questions, how do they contact you?
Well, first of all, my email is elevateteamsolutions@gmail.com. And then I do have a Facebook page, and they can just type Elevate Team Solutions and they can message me that way. My website will be up in a couple of days, but my phone number is 208-681-3862. And I'd be happy to answer any questions. And I do offer a free phone review for 30 to 60 minutes so they can see if we're a win-win for each other.
Awesome. I like the win-win philosophy.
Yes, I do.
Again, thank you so much, Trish. As always, we really appreciate you. And until next time, take care.
Thank you. See you. Bye.